right, well, good morning. I want to start by thanking all Albertans for working together to limit the spread of COVID-19 in our province. Without your efforts and common sense approach adhering to public health guidelines, we would probably be in a very different scenario than right now. Together, you've helped to flatten the curve and protect all Albertans. And as we move forward in the days, the weeks, and the months ahead, it's important to stay vigilant. Part of that vigilance is keeping up with the personal health measures that we've been sticking to since the pandemic began. Measures like staying 2 meters apart, good hand washing, and staying home when we feel sick, or using non-medical masks when it's hard to physically distance. And I'm pleased that we've made non-medical masks available to Albertans at any Alberta A&W, McDonald's Canada, and Tim Hortons drive-thru. Another step everyone can take is downloading the AB Together Trace Together app, the mobile contact tracing app. This helps to let you know if you've been exposed to COVID-19 or if you've exposed others while protecting your privacy. Quickly identifying and isolating positive cases is an important step, an important part of our response to the pandemic, and will continue to be vital as we move forward as a province. Moving forward is our goal, and it's been a collective effort to get to where we are today. I want to acknowledge Premier Kenney's strong leadership. During these uncertain times, he took steps to ensure that Albertans had the supports needed to navigate the pandemic. Now he's focused on ensuring that we kickstart the economy and get Albertans back to work safely. Over the past few months, this province has been tested, but we are strong, and we are dedicated, and we are passionate. And we will get through this together. Thank you again for all of your continued efforts. I would now like to turn this over to Premier Kenney.
Well, thanks very much, Tyler, and great to be here with Health Minister Shandro, as well as our Chief Medical Officer for Health, Dr. Dina Hinshaw, for an important announcement about Stage 2 of Alberta's Relaunch strategy. Albertans should be very proud of their response to the COVID-19 pandemic. The last 3 tough months have left us bruised and grieving, in particular for the loss of 149 of our fellow Albertans. The deep economic and fiscal wounds will take some time to heal. But though we were bent, we have not been broken. In fact, we've come through it better than most, far better than most. Our health system was better prepared. Our response plan launched sooner and was more effective. Our citizens demonstrated great civic and personal responsibility, and our infection and hospitalization rates were much lower as a result. We were able to keep 96% of our economy functioning, 85% of businesses were able to continue operating, and our lives were not as severely curtailed as elsewhere. We've also been able to start lifting more restrictions sooner than elsewhere in Canada and across most of the democratic world. Our first case of COVID infection was recorded on March the 5th. A state of public health emergency went into effect on March the 17th. New infections peaked on April 23rd, and active cases peaked on April 30th. We began lifting restrictions on May the 1st. And on May 14th, Stage 1 of Alberta's Relaunch strategy went into effect. The total number of active cases and hospitalizations has continued to decline, even as the reopening has expanded and testing has increased. Public vigilance and discipline stays steadfast. Our protection of the most vulnerable is strong. We have secured our borders and airports against imported infections, and our world-leading testing and tracing system is keeping outbreaks at bay. In fact, we increased testing to an average of 5,000 per day over the last couple of days. To sum up, we're effectively containing the virus as best as possible. And as a result, I am very happy to announce that Alberta is accelerating our relaunch strategy further to open our economy. This Friday, June 12th, well ahead of schedule, Stage 2 of the relaunch will go into effect for the entire province, and several activities that we had planned for Stage 3 will now be brought forward into Stage 2. This decision is anchored in science and solid data. We needed to hit 3 public health triggers in order to move forward with stage 2. The first target is COVID-related hospitalizations, where we must see either a decrease in those numbers or no more than a 5% increase over 2 consecutive weeks. In fact, hospitalizations have been going down over the last 2 weeks, with only 44 COVID patients in hospital as of yesterday, and that's with about 1,000 acute care beds set aside for COVID patients. Pardon me. The second target is the number of COVID-19 ICU beds occupied. In order to proceed to stage 2, less than half of ICU beds dedicated to COVID-19 can be occupied. Currently, there are 5 Albertans in ICU, which is down from 22 at the peak. That is 12% of our current 50 dedicated intensive care beds. The third target is active cases of COVID infection. As of yesterday, Alberta had only 355 active cases, down from over 1,000 back on May 14 when we launched stage 1. The decrease has been especially strong in Calgary and Brooks, the areas that had been hardest hit by the pandemic. So this means that Alberta has successfully controlled the spread of COVID-19 since stage 1 restrictions were lifted, and that's why we're able to move to stage 2 safely and sooner than expected. Protecting public health and safety stays Alberta's top priority. We'll continue to monitor hospitalizations and intensive care unit occupancy. Enhanced infection prevention and control protocols, including rigorous personal hygiene, 2-metre physical distancing, and masks in public spaces where distancing can't be assured, well, all of those things will stay in place. We'll also be launching an enhanced strategy to focus our efforts on protecting the most vulnerable, especially the very elderly and people with chronic health conditions that often make up comorbidities in COVID-related deaths. And we will continue vigorously to test, track, and trace infections so that we can stamp out local outbreaks whenever and wherever they happen. Alberta continues to perform more COVID-19 tests per capita than all other provinces and most other places around the world. And we've expanded our testing capacity even further. Testing is now available for all Albertans, whether or not they have symptoms. And to add another layer of protection for public safety, we encourage everyone to download the Alberta Trace Together app. The more folks who put it on their phones, the faster we'll be able to notify you if you've come into contact with someone who's tested positive for COVID-19, and that means we'll be able to act more quickly to contain local outbreaks. Alberta Health Services has also launched a new interactive map showing where active cases are. This will keep everyone better informed about the level of risk in their own local community, which will help them continue to exercise personal responsibility for their own safety and that of their loved ones. That province-wide commitment to personal and civic responsibility is what got us to where we are today, and it'll be critical to getting us the next stage of the relaunch right, so that we can then move forward eventually to stage 3. So with those cautions in mind, I'd like to provide some details about the relaxed restrictions and reopenings that will now go ahead this Friday under stage 2. But let me stress that no one should feel obliged to participate in any activity until they're ready and confident to do so, and that includes reopening businesses that have been affected. So stage 2 highlights include reopening the following with the basic public health restrictions in place. First, K-12 schools for requested diploma exams and summer school. Public libraries, more surgeries, wellness services like massage, acupuncture, and reflexology, most personal services like aesthetics and manicures, movie theaters and live theaters, community halls and sports teams. Events and gatherings can also be larger on Friday and beyond in stage 2 with specific guidance in place. These include indoor social gatherings, including wedding and funeral receptions, which can occur with a maximum of 50 people. That's up from 15 currently. Indoor and outdoor seated meetings, including wedding and funeral ceremonies, plus entertainment and sports, conferences, and other events will be able to occur with a maximum of 100 people. That's outdoors. Places of worship can expand their congregations without a limit as long as they maintain physical distancing requirements and other public health protocols that have already been outlined. And the 50% limit on capacity in restaurants, bars, cafes, and lounges is being lifted, with seating limited to 6 per table and all of the usual hygiene rules that people are familiar with. Some facilities and activities originally planned for Stage 3 have been moved forward, as I've said, to open under Stage 2 this Friday with the usual restrictions. And these include indoor recreation, fitness, and sports. That includes gyms, pools, and arenas, instrumental concerts, casinos and bingo halls, which can operate without table games for the time being, and arcades and video lottery terminals in restaurants and lounges. So as I've said, all of these activities must comply with Alberta's public health guidelines, including physical distancing, frequent cleaning, and use of face coverings where appropriate. And there are sector-specific guidelines that have been issued on the Alberta BizConnect website if you're looking for more details. I cannot emphasize how important it is to enjoy all these renewed activities while still being diligent about the basics of public health protection, including physical distancing, hand washing, controlling coughs and sneezes, and masks in public where appropriate. And critically, of course, if you have some symptoms of or test positive for COVID-19, stay at home and self-isolate for at least 14 days. And by the way, if you're in a really dense housing situation where it's not possible to self-isolate, Alberta Health Services is providing support for people like that to be able to get, for example, in a hotel context, to self-isolate. Throughout the COVID-19 pandemic, Albertans have responsibly managed risk, making personal sacrifices to help control the spread and keep themselves and others safe. I'm confident we'll approach Stage 2 of Relaunch with the same adaptability, responsibility, and resilience. There will be more cases, more hospitalizations, and sadly, there will be more deaths. There will be local outbreaks, and some of those may require targeted measures to stamp them out. But if we stay vigilant and disciplined, if we stay dedicated, especially to protecting the most vulnerable, we'll be able to continue lifting restrictions and expanding opportunities throughout the relaunch. As I've said from day one of the pandemic, our responses always need to be equally dedicated to protecting both lives and livelihoods. The restrictions we had to impose to contain COVID had real impacts on both lives and livelihoods, including those with life-threatening illnesses whose treatments in hospitals were delayed, those who lost jobs and businesses, and those fighting addiction or mental illness who lost hope in the future. Easing restrictions and reopening our economy even further is essential to their lives, and that must be balanced, of course, against the risk of COVID. We have to get Alberta working again, restore the jobs that have been lost, and revive the businesses that are barely hanging on. So please support those businesses and other community groups safely, responsibly, and patiently by continuing to respect public health guidelines while you're shopping, driving, or obtaining services, and while you're enjoying recreational facilities and entertainment. I also want to emphasize that although the official state of public health emergency will lapse on June the 15th, that does not mean the end of public health orders. The Chief Medical Officer of Health's orders are not tied to the public health emergency declaration, and her orders need to continue so that we can provide Albertans with the guidance they need to stay safe. But because Albertans have been doing the right thing and acting responsibly, a state of emergency is no longer required. And it was put in place mainly to plan for a potential overwhelming of the healthcare system, which we can be grateful we never came close to over the past 3 months. In the months to come, we still have the power to respond appropriately to the pandemic. The relaunch strategy is really the starting point of our broader economic recovery plan. If we continue to get the relaunch right, the recovery will be quicker and stronger. Businesses and industry will thrive again, our job creators will start hiring again, and hope will be restored even for those who today despair for the future. I'll close by congratulating and thanking Albertans for their cooperation and resolve during the extraordinary events of the past 3 months. It's been an experience that none of us wished for and that no one wants to repeat. We've shown resolve and responsibility at every level of our society. Families, communities, and our shared kinship as Albertans will be stronger by our success. Thank you now, and we'll hear from Dr. Hinshaw and then take media questions.
Thank you, Premier, and good afternoon. I'm pleased to be here with Premier Kenney and Minister Shandro to share the good news that Alberta will be moving to Stage 2 of Relaunch at the end of this week. I know that it's taken us a lot of time and effort to get to this point. I've appreciated your patience as days turned into weeks and weeks turned into months, 3 months this week. At times it felt like we were never going to get to resume our daily habits. And while we're still not back to our pre-pandemic lives, and we need to accept precautions as a part of our new normal, we are closer than we were. I know you're looking forward to be able to resume many activities, and I am as well. It's wonderful that many sports and performing arts activities can begin again, and that people can gather and enjoy the summer in larger numbers. There is more flexibility on physical distancing for small cohorts of people. Friends and families from different households can choose to form small cohorts up to a maximum of 15 people. Performers can interact with up to 50 other cast members or performers. And sports teams can play within region-only cohorts of up to 50 players. These are some changes to restrictions that will be welcomed by many Albertans. But we must temper our enthusiasm with caution. We have made it to Stage 2 earlier than expected because we have remained vigilant. My message to you today is we need to remain vigilant. We must continue to follow public health guidelines. If you organize a sports group or other activity that can resume under Stage 2, please visit the BizConnect webpage for guidance on a safe relaunch. Testing is also key. With more Albertans interacting in larger cohort groups, broad testing will help us to monitor COVID-19 in the population. Even if you do not have symptoms of COVID-19, please get tested as a part of this monitoring. It's very easy. Just go online to alberta.ca/COVID-19 and follow links to the Alberta Health Services website where you can complete the online tool to book an appointment at a time that is convenient for you. If you have symptoms or test positive, you must follow mandatory isolation guidelines. We are moving forward, and your cooperation and efforts to prevent the spread of COVID-19 remain vital. Continue to practice physical distancing and good hygiene. Wear a non-medical mask or face covering in public if you will be in crowded places. Also, continue to take extra care around people who are more likely to get severely ill from COVID-19, such as older people or those with pre-existing health conditions. Follow rules when you gather together and comply with all other public health measures. I know you've heard this many times, but this remains the best advice I can give. I am incredibly grateful for the compassion that you have shown each other throughout this crisis. I am committed to coming back every 2 weeks to share data, and where the data is supportive, we will continue to relax measures as appropriate, provided our triggers remain stable. As we move into Stage 2, continue to take care of yourselves and each other. Enjoy your summer and do so safely. Thank you, and we'll be happy to take questions.
Okay, operator, can you please put through the first caller?
Our first question comes from Rick Bell of the Calgary Sun. Your line is open.
Good afternoon. A question for Premier Kenney, kind of a two-part one. How do you deal with those people, and they will surface, who are saying that you're going too fast or you're doing too much too soon? And those people have been around from the beginning. And what will you say as the numbers go up? And once again, there will be the inevitable people who will predict an apocalypse happening because the numbers go up, even though that's expected to happen. So how do you deal with the people who say it's too fast, too soon, too much, and those who think who will start to panic
Right.
if the numbers go up, as you say they will, because we have more freedom now.
Sure, and we have more freedom, and we're doing more testing. And we absolutely predict that there will be local outbreaks, and from time to time numbers will go up and then numbers will go down. This is the reality that we're in. But I'll say to them what I said on day one, 3 months ago in the legislature, as Britons said when at the height of the Blitz in 1940, keep calm and carry on. That's what we should do as Albertans, keep calm and carry on. Let's have confidence in the remarkable professionalism of our public health system here. We have demonstrated that we can do this right. And we've demonstrated our capacity. Look, I would say to them, the issue is not a small increase of positive cases from time to time. The issue is whether or not our healthcare system becomes overwhelmed. We were able to push up to 2,800 set-aside acute care beds for COVID patients at the height of this pandemic, with hundreds of set-aside ICU beds and hundreds of unused ventilators. We never came close to maximizing that capacity. What we did over the past 3 months was to buy time to increase that capacity and demonstrate our ability to do so. We bought time to get used to the new hygiene and physical distancing norms and educate the public about all of that. We bought time for businesses to get the necessary equipment and put forward plans for safe operation in a pandemic context. We bought time for to learn more about the disease and its characteristics. And here in Alberta, as elsewhere around the world, we've seen that it is very dangerous for the very elderly and those with particular chronic health conditions. We bought time to strengthen our protection of the very vulnerable in continuing care and other congregate seniors' residences. We've bought time for scientists to make progress, we hope, on vaccines or effective treatments in the future. And so that was the point. The point wasn't to indefinitely shut down everything that we do in society. And now we can proceed with caution, but also optimism. So I would say to those folks, stay calm, carry on. We don't need to panic when there will inevitably be increases in active cases. To the contrary, what we need to do is support each other in using these common sense guidelines. And you know what? Enjoying life. I've said this before. People shouldn't feel guilty now about going out responsibly with their family to a restaurant. They shouldn't second guess supporting, going to their local place of worship within the limitations that are in place. They should enjoy the beautiful Alberta summer. They should be able to travel with, observing the guidelines to get out around the province to our provincial parks. We're also releasing today the 50% cap on the number of people who can go to provincial campgrounds. So enjoy life, do it safely, and no need to panic.
Operator, can you please put through the next caller?
Our next question comes from Emma Graney of the Golden Mail. Your line is open.
Yeah, g'day guys. My question is also for the Premier, and when I say question, I do have two. I know it's cheeky, but I'm doing it anyway.
Everyone does them.
So first of all is related to the COVID part, and I'm not sure if Dr. Hinshaw wants to chime in here as well, but curious about how long border control measures are going to be in place at Coutts and also at Calgary Airport, whether there's any further news there. And secondly, completely unrelated, I would like to get your reaction to the First Nations for appealing to the AER over the suspension of environmental monitoring. And I know the AER, there's that line, it is independent. However, this is also part of the ministerial orders that happen as well from members of your government. So they are my two questions. Thank you.
Sure. So on the first question, the monitoring of folks arriving from outside the country will continue indefinitely. As you know, the federal government continues the 14-day self-isolation or quarantine requirement for people arriving from outside of Canada. And are the measures we've taken helped us strengthen that, ensure that that is properly respected and enforced, complied with? And honestly, Emma, I think, I want us to be able to get back as a country, as a province, to reopening travel in a safe way when it's at the right time. Goodness knows we're not going to get our economy back to full throttle, particularly in Alberta's huge tourism industry, until we can safely travel again. So I've asked our public health folks, and I've raised this with my colleagues, the other premiers and the Prime Minister, we need to begin developing strategies to do that safely. And we should be looking at the experience of some other jurisdictions that have very large tourism industries, like Iceland, Austria, New Zealand, and others. They've all developed their own protocols to safely accommodate increases in international travel. One of those things would be very strong health and temperature checks for people arriving. So in fact, I don't see us relaxing those measures. I think the measures that we have put in place at the Cooch border crossing and at the Calgary and Edmonton international airports will be part of the strategy to facilitate increased travel over the months to come. On the question of First Nations, again, the Alberta Energy Regulator is a independent regulatory body. We don't make decisions for them. It would be inappropriate to do so, and if there is any legal challenge, they would have to respond to that. I would point out, I think you were alluding to a different set of measures that had been taken by Alberta Environment and Parks, which simply relaxed the timelines around reporting requirements. It did not in any way reduce the environmental monitoring requirements. They all remain in place, and we must get those reports. But where there was a conflict between some businesses complying with the COVID public health orders and the filing of certain reporting requirements, the Environment and Parks gave them more time to fulfill the reporting requirements. But the requirements are still in place, the monitoring is still there in terms of what the government is doing directly. In terms of AER, I would refer questions to them.
Operator, can you please put through the next caller?
Our next question comes from Julia Wong of Global News. Your line is open.
Hi, thanks for taking my question. I have a clarification question and then another question. The first is, how can gyms, fitness centers, recreational facilities reopen safely, and what measures must they take? And my other question is, other than lower case numbers, hospitalization rates, and ICU capacity, what roles did expanded testing and an R0 of 1 play in an earlier phase 2? And were the concerns about the spike that we've recently seen in Edmonton when it comes to that phase 2 decision?
Sure. Those are great questions. They're a little bit more technical, so I'm going to invite Dr. Hinshaw to respond.
Thanks, Julia. So the first question with respect to the gyms, fitness centers, and recreation and how they can open safely, we do have detailed guidance on that particular sector that's available on the website today. And essentially, the guidance looks at the difference between low-intensity activities and higher-intensity activities and puts some restrictions in place in terms of distancing measures, which would be greater for higher-intensity activities. For lower-intensity activities, the distancing of 2 meters would be adequate. With some enhanced measures for the regular cleaning of equipment, where there's possibility of people bringing their own equipment, such as if they're participating in a fitness class like yoga, bringing their own equipment would be recommended. And other measures such as regular screening, so anyone attending would need to go through some screening to make sure that they're not ill, that they haven't been in close contact with someone who has COVID, that they haven't returned from international travel in the last 14 days. And so there's a list of those kinds of requirements and the guidelines and measures that those business owners can take to ensure that their customers and their staff remain safe. And again, that's posted on the website. If not already, it will be later today. The second question about what role the R0 and other measures played in our decision to go with an earlier relaunch. Certainly it's been encouraging as we've moved through stage 1, as we've opened additional businesses and activities, to see that our case numbers have been stable or declining in almost all areas of the province. And so again, R0 is something we do watch as a contextual measure, with our main metrics being, as mentioned, hospitalization, ICU, and as was mentioned, we now have a regional metric of 50 active cases per 100,000, which is going to be live on the website today as a means that will inform Albertans of what's happening in their local area. And so watching those metrics were also important in moving up the stage 2 of relaunch. With the cases in Edmonton recently, I think it's a reminder again that we need to all practice diligence in our public health measures, in our distancing, making sure that if we're sick, we're not attending any kind of public event, that we're getting tested right away. And what I want to say about the recent increase in Edmonton is definitely that we are watching it closely, that we see a few events with transmission happening, a few workplaces that we're watching closely. And I also want to really commend those who went forward for testing, because the worst possible outcome from a stage 2 relaunch would be for people who do feel sick to avoid testing or to not work with public health when we're doing contact tracing. That would be the absolute worst possible outcome. If people feel ashamed, if they sort of hide from public health, it means that transmission could continue undetected and have a higher likelihood of reaching those at high risk for poor health outcomes. So again, while we are concerned about the numbers, we are really grateful that people are choosing to come forward, and encourage anyone who has any symptoms, remember, stay home, don't go out, get tested, and cooperate with public health so that we can make sure that our community remains protected.
Operator, can you please put through the next caller?
Our next question comes from Rafi Buchanan of CBC. Your line is open.
Hi. Thanks for taking my questions. I'm going to jump on the asking two questions bandwagon. The first one could be for Dr. Hinshaw and Premier Kenney. I was wondering what you think of the tweet that has pointed out someone was just able to go and pick up 10 packages of 4 masks when she went to get one coffee. Are you concerned that the honor system could be, not working so well? And the second question would be for the Premier. It's about the post by your Deputy Speaker, Angela Pitt, remarking about how perhaps Alberta should explore an autonomous system, not quite separating from the Federation, but adopting the same system as in South Tyrol in Italy. Thank you very much.
Well, thank you. I'll answer the first question about the masks. And as I said when I first announced the initiative, I guess a few weeks ago, I made it very clear that we have to operate on the honor system. But just the same way that when it's come to our response to the pandemic, that we've been operating on the honor system already, that it's only through, as an entire province, all of us complying with the Chief Medical Officer of Health's orders, that we've been successful to date. So we have to operate on the honor system. And I think, look, if we find the rare situation where somebody decided not to do that, look, I think most Albertans can be trusted. I think Albertans are responsible, common sense folks who know what needs to be done to take care not just of themselves and their family, but for the whole province. And we need to be taking care of each other. As Dr. Hinshaw keeps on saying, we're going to get through this together. And so my message to all Albertans is to remember that advice. We're going to get through this together, and we're going to do it by not just in this situation with masks, by doing this on the honor system, but making sure that our compliance with every measure is going to be on the honor system and working together. And so that'd be my, and then I'll let Premier answer the second question.
And I would just add on the masks that we fully expected that some folks are going to ask for more than one packet to, if they've got a large family or neighbors, elderly neighbors, for example, who can't get out. So it is legit to ask for and receive more than one kit if they're actually then passing them on as a courtesy to their neighbors and friends. But obviously, if people are just hoarding those, that would be very disappointing. And as Tyler says, I think that would be extremely rare. In terms of I haven't seen the tweet in question, Rafi. I will say that, of course, MLAs are going to be able to, they do speak their minds as they should on behalf of their constituents, including provoking debate on various issues. That's part of democratic discourse. Obviously, the government of Alberta is committed to a stronger Alberta in the Canadian Federation, and that means more autonomy for us in the Federation, a stronger exercise of our constitutional rights in the Federation. That is a central part of our fight for a fair deal, and we're doing that in concrete ways. The creation of Alberta Provincial Parole Board and Provincial Chief Firearms Officer are two recent initiatives. We will be releasing the Fair Deal Panel report in the fairly near future, which outlines a lot of other ways that Alberta can assert its role within the Federation, its constitutional jurisdiction. So I don't see that. Again, I haven't seen the comment itself, but I don't think looking at the ways that different federations function around the world is unreasonable when we're having a debate about Alberta's role in the Federation.
Operator, can you please put through the next caller?
Our next question comes from Tom Vernon of Global News. Your line is open.
Hi, thanks for taking my question. I think this one will be for Dr. Hinshaw. Maybe clear up some confusion as I read this. We're talking about cohorts of 15 for families being expanded, but we're also talking about sports teams. You're allowed to go back and play sports, gatherings of 50 outside. So for parents out there who are looking at the idea of maybe sending their kids to soccer camps or something like that in this cohort of 15, can you provide a little bit more clarity on that, please?
Sure, and I think one of the important things to consider when looking at the cohort numbers and how they're structured is that each family is going to have to consider their own particular context, the individuals within their family circle who may have risk factors, and how wide they want to expand their family circle, because of course the wider it expands, the more risk there is of potentially introducing COVID-19 into that household. So these numbers really are kind of guidelines for people to consider as they're thinking about how to expand their social circles. The cohort concept is for groups of people where physical distancing is not always possible. So we talked about that cohort family concept before, where two households could cohort together, where kids could play together, where the adults wouldn't have to constantly be thinking about physical distancing. And so you created sort of a safety bubble. And the expansion to 15 for that household cohort concept is, again, a guideline for the number of people within whom, if you were interacting without consistently observing that physical distancing rule, that you would be able to then, if someone were to get sick or get COVID, quickly contain it. You would have a smaller group of people within whom to contact trace if there had been a recent gathering. With respect to the sports and performance cohorts, we did expand those somewhat larger than the household cohort. And this will all be, we actually have a cohort guidance document. Again, if it's not posted today, it will be coming soon, because we understand people have questions about this. So we recognize that people cannot play team sports while maintaining consistent 2 meters distance at all times. We also recognize that sports provides mental and physical health benefits. And so again, this is about risk mitigation and setting out a rule of 50 people per a sports team cohort, so that depending on the nature of the sport and the number of people on a given team, would potentially be 2 up to several teams that could participate in team play together. And we have specified that household members, so if you have a household cohort of 15 for social interactions, that they could also participate in a sports cohort if that family wants to take that risk. Again, these numbers do not guarantee safety. What they do is they help us contain, if there is an exposure or a small outbreak, contain the total number of people who would be exposed to make sure that it doesn't spread widely. So each family has to determine what their level of risk tolerance, the risk factors in their household, and be committed to informing all other members of their cohort if there is a case of illness where there could have been an exposure. That is distinct from our social gathering limit. So as mentioned, we have a social gathering indoor limit of 50. And in those social gatherings, such as a wedding reception or a birthday party, we would be expecting that physical distancing would be maintained in that social gathering, because those are some of the highest risk activities for widespread transmission of COVID-19. So if you have a structured sporting event where participants are sitting on the sidelines, appropriately distanced, and the only time they come in close contact is while they're playing, that's actually in some ways a lower risk than if you have 50 people inside a house at a party where you could have a massive exposure where all become infected. So again, social indoor gatherings, we expect the distancing to be maintained. And as I said, there are guidelines on the website that outline that, and there will be some coming soon for cohorts.
Operator, can you please put through the next caller?
Our next question comes from Jeremy Thompson of CTV. Your line is open.
Hello, thank you for taking my questions here. The first one is just about a recent survey done by the Alberta Teachers Association that found, that the top priority for most teachers is just sort of general safety when classrooms reopen again. So what does, I guess, the similar sort of concerns to, gyms and rec centers in that way, but how do you, ensure that it's safe, and what does this stage 2 announcement mean for, September, classes in September? And the second one there is, I noticed that you're still not lifting restrictions on visits to, hospitals and healthcare facilities and that sort of thing. How do you decide to do that while at the same time allowing, places like massage businesses to open up?
Sure, I'll just take a stab at the first question, and then Dr. Hinshaw can add some detail. The Cabinet will be considering a detailed proposal this week coming from the Department of Education on how to safely reopen the schools, and that will be based in part on input from the Teachers Association, school boards, parents' councils, and others. So there's been extensive consultation on how exactly to do that, and that there will be very detailed guidelines published specifically for the schools, so that they have the whole summer to prepare for that. And Doctor, would you like to add on to that?
So with respect to summer schools, for example, we have again developed guidance for summer schools that include smaller class sizes, distancing, and also we have learned from our experience opening daycares where we've had very minimal issues with the enhanced cleaning, the regular screening for symptoms, making sure that there's increased hand hygiene, and with the older children who are in care, trying to maintain some distancing. And so we haven't actually seen issues with that daycare model. We're going to be obviously cautious and watching, but the summer school guidance, again, follows those same basic public health principles, and we'll be able to learn from summer school experiences as we're learning from other jurisdictions who've opened their schools earlier. And as the Premier mentioned, all of that then goes into decision making for the fall. With respect to the second question, the visitor guidelines for Alberta Health Services have actually changed. So anyone who's wishing to visit a loved one in an acute care facility in a hospital can go on the Alberta Health Services website to see the current guidelines, which do allow up to 2 visitors per person who is in hospital, as long as they follow certain guidance. We are looking at our long-term care, continuing care guidance for visitors and the enhanced restrictions in those settings. And we're wanting to create opportunities to hear directly from family and residents of those facilities, because we know that visitor restrictions there are placing a heavy burden with respect to social isolation, and that can be very challenging, even with the opening of outdoor visits, for example. So we are looking to balance in those settings, which are the highest risk settings for severe outcomes, for outbreaks that include, unfortunately, deaths in those settings, which we've seen in this province and others. So we are really working hard, wanting to hear that input from families and residents as well as operators to try to find the right balance so that people can have all of their health needs met, not just protection from infectious diseases, but all of the other parts of health. But we cannot abandon a need to protect people who are high risk for severe outcomes and who live in congregate care settings, because an individual may want to make a choice for themselves as an individual, but when they live in that congregate care setting, that has consequences for everyone else they live with. So there's that balance between individual and collective, and also wanting to make sure that we get the balance right between COVID protection and ensuring that people have what they need to be healthy overall. So that work is underway.
Operator, can you please put through the next caller?
Our next question comes from Amanda Stevenson of the Calgary Herald. Is open.
Hi there. This question is for the Premier, and it's just following up on the travel issue. We've got airlines and the tourism industry saying that they're lobbying for the provinces and the feds to coordinate to remove travel restrictions between provinces. Obviously, there's a bit of a patchwork across the country in terms of who's allowing who to travel where, or whether people are even allowed into a province at all. Is that something that you're interested in working on? And I know they're also concerned about the 14-day quarantine requirement for returning travelers, and wondering whether there's any chance that could be lifted in time to salvage a bit of the summer tourist season.
So the answer is yes. We have discussed that with every Thursday afternoon. All of the premiers meet by telephone, and this issue has been raised constantly. We don't have any travel restrictions. I think Northwest Territories still has restrictions on Albertans going north, but I've been very happy to work with Premier Horgan on our west side and Premier Moe on the east to keep those borders open. I understand that they've had a general guideline asking people from outside the province not to travel there, but there's no actual barrier. You don't get blocked or screened when you're going into British Columbia. And I understand that BC will be lifting that very soon. So I think this is mainly the question of interprovincial travel restrictions is mainly down in Quebec, New Brunswick, Nova Scotia, and so on. And they've got some unique challenges. We'll let them sort that out. But in terms of the broader travel issues, like I said earlier, I've been pushing for the federal government, working with the provinces to sort out how we can safely expand travel. And that may require at some point a more a smarter way of applying the self-isolation requirement. So, for example, I note that what countries like Austria and Iceland that are highly dependent on tourism are doing is they're offering immediate testing upon arrival at their airports. And as soon as somebody comes back positive, then they're notified and they're allowed to proceed with their get outside of self-isolation. So New Zealand's doing a different thing. They're using, I think, some technology, a Bluetooth tile, to help. So there are a lot of different ways of doing this, but and we're not ready to do it yet for sure, but we can't just suspend global air travel for the next year. I mean, that would continue massively to damage livelihoods and impact people's lives. I mean, just think of the hundreds of thousands of Albertans whose livelihoods depend on the tourism industry. So we got to figure out a safe way of facilitating international travel. We think Alberta's been a leader on this by positioning our some public health support at the airports with, for example, infrared temperature scans like they have in the Asian countries, in Australia and elsewhere, and providing information at the airports and checking for symptoms. So those are the things that we'll have to do in the future. But I do believe we've got to start thinking about taking steps towards safe travel.
Okay, we have time for 3 more. Operator, can you please put through the next caller?
Our next question comes from Graham Thompson of iPolitics. Your line is open.
I have a question. Thank you. I have a question for the Premier. It's on a different topic. It's on the protest, on the Black Lives Matter protest. There was a protest planned for this weekend in Innisfail, but organizers have faced a big backlash on social media from people making racist comments, people saying there's no need for a protest because there's no racism in Innisfail. So the town is now attracting all kinds of critical attention online from people around North America and even further. So I'm wondering, do you have any comment on this? Do you have any advice for protesters or organizers? Should they have this protest go ahead? And a second part of that question is, Premier, do you think there's a systemic problem of racism in Alberta?
Well, I don't know about that particular issue that you've raised with Innisfail, but let me just say that racism is always and everywhere an evil. It's a sickness of the soul. It must be condemned at every turn. And we must recognize a history of institutional racism here in Canada that sadly has touched us in Alberta, and that far too many Albertans continue to face racial prejudice. My own minister, Casey Madhu, has spoken to that in his life in Canada and the experiences that he has faced. And we should acknowledge as well that people of Afro-Caribbean heritage, Black Canadians face unique challenges when it comes to racism, as do Indigenous Albertans. These are sadly realities. It's also true that I think Canada and Alberta does much better in advancing human dignity and equality of all before the law than the vast majority of places around the world. But that is not a reason to deny or to minimize or negate the challenge that we continue to face. And so I commend Albertans for speaking out against racism in this current context, against anti-Black prejudice in particular. And I would say to people, if they're denying that it exists in Alberta, that they're just wrong. They need to listen to the experiences of Black Albertans, of other people from racial minority backgrounds. They need to honor their voices, their lived experience, and seek ways to reach out and do better. So in terms of protests generally, I will refer you to Dr. Hinshaw's comments yesterday. While we respect and champion the constitutionally protected freedom of expression and assembly that people exercise with protests, we just ask that organizers do their very best to exercise that in a way that is mindful of our public health measures, to avoid the potential of super spreader events at this really challenging time, at large scale events where contact tracing and tracking may be basically impossible. So at this particularly sensitive time, when so many people have made so many sacrifices and impairment of their own rights, we would just ask folks who feel passionate about these issues, and rightfully so, to seek to express their voice in a way that is safe.
Okay, we have time for two more. Operator, can you please put through the next caller?
Our next question comes from Keen Dext of Rebel News. Your line is open.
Hi, Premier. Thanks for the opportunity to ask you a question. I also have two, and they're both for you. Several weeks ago, a man was protesting Justin Trudeau's gun grab outside the steps of the Alberta legislature. He was hauled away by his arms and his legs, and that Albertan was actually physically distancing. The numbers at that protest were actually pretty low. In comparison, thousands of people have come together in downtown Calgary and in Edmonton across the province, and they were packed like sardines. Nobody was physically distancing, and nobody was given a ticket either, much less arrested. So I'm wondering why that was. And also, second question, several weeks ago, Tom Ross of 660 News asked you a question about a Green New Deal. That conversation went pretty viral. That conversation went pretty viral, and just a few days after that, he announced on a podcast quite proudly that he was a communist. I'm wondering if you're concerned that communism is leaching into the mainstream media.
On the first question, on the first question, let me say that, look, as I just said in response to Graham Thompson, our government respects and champions the freedom to protest. It is a exercise of fundamental constitutional freedoms, to freedom of speech and freedom of association. And when that one arrest did occur, out of the many different protests that have happened over the past 3 months, as you know, we raised questions. The government does not and should not micromanage operational decisions of police, of course, and did not in that instance, but we certainly did ask questions about why there was an arrest in that instance and there had not been in previous protests before the legislature and other public places. I will just say this, immediately following that arrest, we expanded the allowable number of public gatherings to 50, thinking that would address the issue and allow for those smaller scale protests that we had been seeing. And I totally know what you were saying. As far as I could tell, I looked out the window of the legislature over the past few weeks at smaller protests, and people did seem to be commendably distancing themselves and being mindful of that. In terms of these larger events, look, or any protest, Dr. Hinshaw said something that I thought was very wise when we started this response to the pandemic, that we, quotes, can't enforce our way out of this. And I believe that's true. And that is, we do hope that law enforcement agencies, all through this, we've hoped that they would apply the public health measures or enforce them with a great deal of common sense. And in terms of the large recent protests, let me once again state that people are right to speak out against racism in general and anti-Black racism in particular. People are right to raise passionate concerns about abuse of state power by police. There's no argument on those points. I would just say to folks who have been thinking of coming together in very large groups, well above the now 100-person limit for outdoor gatherings, that if they're doing so, what they're saying to their fellow Albertans who are making enormous sacrifices, suspending their businesses, having shut the doors of their places of worship, having seen their own fundamental rights impaired, what they're saying is that those sacrifices are somehow less worthy than their own desire to gather in large groups. So we would just ask folks, if they're thinking of doing protests, please think about creative ways of doing that comply with the safe public health rules. And if you're going to get in a group with thousands of people, we would ask that you go and get yourself tested at the very least, as Dr. Hinshaw did yesterday. Oh, and on the second question, I didn't hear the comment to which you're referring. I can only assume that Mr. Ross's comment was made in irony, or that it was made in jest or humor, because I just can't honestly imagine any serious person in this day and age claiming to belong to ascribe to an ideology that resulted in the deaths of some 100 million people over the past century.
Okay, we have time for one more. Operator, can you please put through the last question?
Next question comes from Audrey Nouveau of Radio Canada. Your line is open.
Hi, Mr. Kenney. My question is for you in French again. Donc, en français, je voulais savoir qu'est-ce que vous dites aux gens qui trouvent que de lancer la phase 2 du déconfinement une semaine plus tôt, c'est trop tôt, c'est trop rapide. Qu'est-ce que vous leur dites pour les rassurer?
Je dis que la décision a été prise selon les données et les preuves scientifiques que nous avons fait énormément de progrès. Nous avons vu une diminution des chiffres d'hospitalisation et des infections en Alberta. Nous avons augmenté la disponibilité des tests pour le COVID-19, mais le nombre des cas actifs continue à diminuer. Évidemment, il y aura les vagues à l'avenir, il y aura les augmentations de nombre de cas actifs. Mais il faut que nous cherchions un équilibre entre les mesures de santé publique et la vie sociale, économique, la santé sociale et économique des Albertains. Je crois que c'est tout à fait raisonnable de le faire parce que selon nos normes, les normes que nous avons établies, nous avons dépassé ces normes-là en ce qui concerne la diminution des cas actifs et de hospitalisation en Alberta. Alors, nous gardons toutes sortes de mesures de santé publique. Il faut que les Albertains continuent d'être responsables et suivre toutes les recommandations du Dr. Hinshaw. Mais nous pouvons réouvrir beaucoup plus de notre économie, de notre vie sociale, de façon sûre, avec la capacité que nous avons créée dans le système de santé dans les derniers 3 mois.
Okay, thank you very much.
Thank you.